Assalamualaikum warahmatullahi wabarakatuh. Let me introduce myself. My name is Siti. I am from DT Nursing Class 1B. In this presentation, I will discuss about summary material. Okay, next, wound care. The first, discussing wounds management. The second, describing wounds. The progress of wounds treatment is monitored and recorded in a clinical pathway or integrated care pathway (ACP) document. A specialist would chart describe the dimension of the wounds, the type of discharge from the wounds, and the presence or absence of infection. The third, taking part in continuous professional development. The fourth, using a wound assessment chart. Okay, next. Medical specimen. The first, explaining pathology test. The second, asking for classification. The third, contacting other staff. The fourth, explaining renal failure. The fifth, softening a request explaining urinary catheter. The sixth, reading a pathology report. Okay, next, how about present something? The first, greeting. Good morning, ladies and gentlemen. I would like to say thank you for coming in my presentation. It's great to see you all. My name blah blah blah. The next, Assalamualaikum warahmatullahi wabarakatuh. Thank you for coming to this presentation. I'm glad to see you all. Next, good morning, afternoon, ladies and gentlemen, and honor to meet you here. Okay, the second, introducing the presenter. The first, let me introduce myself and my partner. I am blah blah and my partner is blah blah. We are from blah blah blah. The second, let us introduce ourselves. I am blah blah blah. Next to me is blah blah blah. The third, let me introduce myself. My name blah blah blah. I am from blah blah blah. Okay, the next, state the focus of the topic. The first, in this opportunity, I would like to present blah blah blah. The second, the purpose of my presentation is blah blah blah. The third, in this presentation, we will discuss about blah blah blah. The fourth, please look at the picture. What do you see in this picture? Great, we will continue finding out what is going on there. Okay, next, here's the main content of presentation. The first, as transition word, the first, then, next, the last. The second, reason contrast or result because, signs, but, however, although, in addition, therefore, and consequently. The third, examples. The example are blah blah blah. The only example of this page is blah blah blah. Okay, next, question and answer. The first, anybody would like to ask? The second, there will be question and answer in this presentation. The third, just feel free to interrupt me if you have something to ask. The fourth, you can freely ask questions about this presentation. The fifth, I will try to answer any question you may have. Okay, next, make a summary. The first, in conclusion. The second, in summary. The third, so the points are. The fifth, in short. The fourth, in short. The fifth, to summarize. The sixth, to sum up. The last, to conclude. Okay, the last closing. The first, thank you very much for your great attention, ladies and gentlemen. The second, thank you for your attention. The third, thank you for listening. May all thoughts we have shared be beneficial for all of us. Okay, medication. The first, administering medication. The second, doing a medication check. The third, working as part of a team. The fourth, checking medication order for accuracy. The fifth, explaining drug interaction. The sixth, checking the fifth rate of medication administration. The seventh, reading a prescription chart. Okay, thank you for your attention. Wassalamualaikum warahmatullahi wabarakatuh. Bye bye.